Hello and welcome to this video on what IV fluids are, what they're doing in your body when administered, why the choice of IV fluid matters, and what happens if it is the wrong choice. How many times in a movie or TV series has a doctor called for fluids for a patient in the emergency room? How many times do they just pull out a bag of saline? How often does this happen? The answer to these questions is all the time, too often, and always, unless they have plot armor, or a coin flip if it is a background character. The problem we have is also simple. The answer to these questions are far more complicated than just one word or a glib and facetious joke. It should be too often, and no, it should be far more complicated than just a bag of saline, since that could kill. IV fluids are largely used for one of two things: either the controlled delivery of drugs, or the control of lost blood and tissue fluid volume. The seemingly simple use hides the complexity of what, how, and why you need to have these functions, and certainly how it achieves them. The reasons the application is not obviously wrong owes to the complexity of blood volume management and drug miscibility. Both of these can and often are not even remotely considered in Hollywood or any other media, such as TV and movie production. At its simplest, IV fluids are literally a simple mixture of water and sodium chloride. Importantly though, it is a very specific amount of sodium or salt in water, and the water must be sterile. Most typical saline is 0.9% salt in water, and that means it is just under 1 gram of salt in 100 milliliters of water, or roughly 9 grams in 1 liter. That would be somewhere around 1/3 of an ounce in a quart of water if you wish to use freedom units. The reason we struggle right now, especially in some hospital settings with IV fluids, and this is partly the answer, is that instead of having to worry about the constituent ingredients, that being the salt and water, it is instead the containers, typically a sort of plastic bag, and the various regulatory hurdles to get approval for production of saline and various other IV fluids. It means that saline is already more complicated than just water and salt. But we now need to not only have the realization that it's complicated to make, given that you apparently need regulatory approval, but that there is more to this than just the basic version. There is often a lot more to it, and for good reason, and we'll get to that in due course in this video. So to understand what is happening, let's look at first its application and use. We'll start with fluid management only. That is, a patient is presenting with either acute or chronic low blood pressure, for instance. This is properly called hypotension. Now, it can be caused in a variety of ways, but the simplest would be, for all intents and purposes, when there is just too little blood in the body. This can be caused by many things. For example, it might be sudden systemic vascular dilation, edema, internal hemorrhage, or even external hemorrhage. The end result, no matter the cause in this case, is going to be a drop in blood pressure. In the case of vascular dilation, it's the blood vessels get bigger, but the blood volume hasn't changed, therefore it essentially gets spread out over a wider area. Think of trying to spread out some sort of spread, peanut butter, jam, etc., over too wide an area. It just has to spread thinner and thinner, and eventually you start seeing holes where it can't cover it. That's essentially what's happened. If the cause of this is unknown, the doctor is going to start providing an isotonic or hypertonic IV fluid. The use of these is for a very simple reason, because it either replaces the blood volume as it is, or attempts to pull back any blood fluid back into the blood vessel itself. Now, the reason this happens is simply down to osmosis. Osmosis is a process in which, rather than a solute diffusing across a semi-permeable membrane, the water instead diffuses. Effectively, the solute, for example, the sodium chloride in it, cannot get into the other side of the membrane or through it, and so the water, trying to dilute it down, travels to the other side. This means that if you have more solute on one side of the membrane, such as inside the blood vessel, and it can't get through the blood vessel wall as quickly, the water will stay on the inside of it. This is why hypertonic IV fluids are used. It helps to keep blood volume in the blood vessel, and therefore blood pressure up. The other effect it has is that it will pull on any fluids outside the blood vessel, trying to draw them into it as well. The consequences of increasing blood volume, if it is not just to replace lost fluids, is that the kidneys will gradually remove this excess fluid via excretion as urine. This will lead to the gradual but certain reduction in blood pressure and tissue fluids. It's particularly useful in dealing with edema, as the fluid that would be outside the blood vessel, due to edema, gets drawn back into the blood vessel, and then you pee it away. Isotonic fluids are somewhat similar. Similar in that they help to keep up blood volume temporarily. Unlike hypertonic solutions, this does not stay in the blood vessel for anywhere near as long. This solution is, to be blunt about it, it has practically no difference between it and regular blood solute levels. It is fundamentally equal in its concentration. That does lead to the water diffusing into local tissues around the vascular system over time. This is due to that osmosis effect. Essentially, the amount of solutes in that isotonic solution and the tissues is the same. So lots of fluid in the blood vessel means some of it travels to the other side of the semi-permeable membrane in the form of the blood vessel to equal out. At the same time, some of the fluid is retained in the vascular system, and this can help to elevate blood pressure. For the most part, however, it's used primarily to try and rehydrate that tissue outside the blood vessel. Now for why you might want to use a hypertonic solution. Hypertonic, as in less solutes in it than you would otherwise have in blood, plasma, or other fluids that you are using. The hypertonic solution is the exact opposite of the hypertonic. A hypertonic solution is used when, rather than worrying about blood pressure, the issue is going to be specifically tissue fluid levels. That is something outside the vascular system. You need the hypertonic solution because it's intended to perfuse into the blood vessel and then into tissues to ensure maximum tissue hydration. A very crude analogy would be a hangover. The hypertonic solution would help to rehydrate your brain and thereby mitigate the effects of alcohol consumption and the consequential dehydration of the brain, called a hangover, because all the fluids that are in the hypertonic solution and then into the bloodstream get to the brain and rehydrate the brain, thereby mitigating the dehydration of alcohol. It's typically used in a clinical context for things like vomiting or other GI tract fluid loss, rather than something like a hangover, although theoretically there's going to be some doctor or paramedic somewhere who's decided that they just can't deal with that hangover that day and therefore have chosen to administer themselves. But ignoring those outliers, this is its primary application in very broad terms, let's say. It's by no means an exhaustive list of applications, but it's very much a general description of the broad classifications. It's also why you have 3 different categories: hypertonic, isotonic, and hypotonic. 3 different kinds of IV fluid. We now need to look at what is in the 3 different types of IV fluids before getting to the why you need the different types, beyond just making the 3 different tonicities. Tonicity being how much solute is dissolved within the fluid. Understand, we've spoken about the general purposes already, that is, essentially increasing blood volume, trying to draw fluids out of extravascular tissues, and trying to infuse extravascular tissue with, well, in this case, water. The very common inclusions within an IV fluid will be dextrose, sodium chloride, and lactate. However, there are many formulations out there, arguably hundreds, and each will have their own quirks, let's say. Some have more of this, some have other ingredients, some have less of that various thing. It's a very extensive area, but we're just talking in broad terms here. And it's because each of the 3 ingredients we're going to cover does a few things that are very important. And in some respects, the application of these ingredients can be applied to other ingredients as well. The obvious use of dextrose, for example, is as a sugar. It is literally a sugar. However, dextrose as a source of sugar, and particularly being useful for hyperglycemic states, is a different matter again. Unlike a regular sugar, if you were to consume it orally, it takes time to be absorbed. Dextrose in the form of an IV fluid, straight into the bloodstream where the body can start using it. However, another thing here is that because it goes straight into the bloodstream, it immediately enters cells, and as it enters the cells, we get osmosis kicking in again, which leads to those tissues becoming rehydrated, because you now have solute in those cells in the form of dextrose. The saline, or the sodium chloride part of this, is actually an electrolyte preparation. Now, normally the level is about 0.9%, and it doesn't really cause any shift in fluids. That is essentially the same amount of sodium chloride inside the cells and inside the blood, so you don't see any change, but that doesn't mean that you don't get different preparations. There are different forms of saline that can be more or less, so they can be below 0.9% and above 0.9%. Typically you'll see somewhere between 0.7 and 1.1% being the typical range, although again there is some more variation than that. Below 0.9% it causes cellular hydration, more than 0.9% it causes cells to be dehydrated. And in fact, this can also be applied in a sort of backwards logic to the dextrose. Dextrose can do the same thing. The more you increase the amount of dextrose that's within your IV fluid, the more fluid will enter cells due to that osmosis. In the same way, the second effect, and something you need to be aware of, particularly with a lot of these ingredients, is that things like sodium chloride and other ingredients will cause the pH of the IV fluid to change. IV fluids with sodium chloride start with a pH of 5.5. Blood should have a pH of somewhere around 7.4. This is a very big gap between what you want and what your body needs. Now, this is not to say there aren't ways to overcome it. The body does have natural buffers within the bloodstream allowing it to adjust for that, but you don't necessarily need to rely on those, particularly if you have other issues we'll get to in due course regarding the body's most, let's say, delicate states, particularly after, say, hemorrhage. You have something like lactate. A lactate is a conjugate base of lactic acid. As you can imagine from a name like lactic acid, it is, well, an acid. A conjugate base is essentially when the lactic acid gets its hydrogen ion donated somewhere, and so it no longer becomes an acid. It's the opposite. It's now able to receive that hydrogen ion and becomes the conjugate base. Essentially, your lactic acid and lactate is a very weak buffer that can either accept or donate the hydrogen as needed. And why this is important is it helps to maintain pH levels. Lactate also acts as another form of electrolyte that helps in the movement of water via osmosis as well, so there are a number of roles it can play, much like everything we've mentioned so far. It's not just that, say, sodium chloride provides a pH change, or that it causes a shift in tonicity. It acts as an electrolyte, and there are sorts of other roles all of these will do in due course. But it does bring us to particularly importance of using IV for medication. As noted, IV fluids are typically as slightly acidic as they are, and that's down to that sodium chloride. That is to say, saline by itself is an acidic solution. As a consequence, you must be careful, and in some cases, actively use a different form of IV fluid with some medication. In fact, you must use some IV fluids for certain medications. For example, if you want to provide a drip with insulin, using an acidic solution would be a terrible idea. Acidic IV fluids would lead to the protein-based insulin being denatured, and without insulin and somebody obviously needing it, they're probably going to die. Of course, if you're still providing the insulin in an acidic solution, the protein that makes up insulin gets denatured and won't work, which is, for all intents and purposes, the same as not giving them insulin in the first place. There's just a few extra steps and a waste of a dose of insulin involved. In other cases, the medication when being administered via an IV line needs certain pH or other conditions to work. That means you must have the right conditions. Like with insulin, if you do not use the right IV fluid formulation, the medication will not work before it even enters the bloodstream. This is one of the reasons that hundreds of different formulations for IV fluids exist, beyond the differences in just the hemodynamics and the tonicity that we've mentioned so far. But we focus on that in particular simply because it's an easy way to understand what's going on. Another issue beyond what we've spoken about so far is that by being continuously infused with IV fluids, you need to be mindful of how it will affect the body. We already mentioned the role of IV fluids, particularly with regards to tissue hydration and dehydration and similar, but sometimes too much fluid or the wrong tonicity can lead to harm. In fact, this is going to be our next major point, and it's one of the reasons why we take such issue with how it's depicted in most media. And before that though, we have the infusion of IV fluids can lead to issues around electrolytes. Sometimes having too much of a good thing is bad. For example, enjoying a little bit of whiskey is good, and drinking an entire bottle of whiskey is bad, mostly because it would be very expensive. Enjoyable, but expensive. No wait, it would be bad for you because it would cause drunkenness. And that's bad. No? Wait. There's a lesson here, we're just not sure what. Maybe we should try remembering by drinking a bottle. No. Electrolytes cause the fluid in the body to enter the place where they are in the highest concentration. Essentially, body water follows electrolytes. If they're in tissues, the blood volume goes down. If it is in the blood, the tissue water volume goes down from tissues. If the solution is isotonic, nothing changes with fluid balance, but the volume goes up everywhere. You are essentially screwing with the natural balance of the body. Sometimes this is good, But if you are altering it when and how it doesn't need to be altered, you are creating complications. Complications that can lead to big issues that we'll get to in due course. And let's start with how IV fluids can be not just a problem, but in some ways the biggest cause of concern. You have things like heart failure, liver failure, and renal failure, which can all be exacerbated considerably by the use of IV fluids. If you suddenly increase blood volume or just tissue hydration, you can create problems that cascade quickly. The best and easiest example is the heart. The human heart, if weakened, cannot easily cope with an increase in blood volume. It simply tires out quickly and you might experience problems at best and heart failure at worst. So yeah, not good. The liver is similar again. The difference is that the liver cells, the hepatocytes, are harmed. This is important when we're looking at, say, albumins from the liver, which are very important for blood tonicity. The albumins that are produced amongst many other blood proteins help to try and pull water back into the bloodstream, into the blood vessels, and therefore out of local tissues. If you aren't producing these proteins, you're going to have problems. And once you start harming the liver, you begin to harm things not only around tonicity, but it's the ability to metabolize things, the ability to detoxify the body, and possibly, if you've really stuffed up, actually start killing liver cells, the hepatocytes, by causing so much water to go into them that they begin to essentially be lysed or destroyed. The last, of course, is the kidneys. The kidneys are primarily the organ responsible for controlling blood volume, and this also means they are especially vulnerable to changes in blood volume if it is both sudden and extreme. The increase in blood pressure can cause the nephron, or the functional unit of your kidney, to be damaged and in some cases utterly destroyed. On an intermittent basis, this sort of problem can be healed. For example, after extreme exercise. If you take part in, say, a marathon, your body will recover from that extremely high blood pressure from running for a stupid amount of time and contributing to global warming. However, you're also going to damage the nephron. But it can be healed, assuming you don't do a marathon one day, then another one, and repeating on forever, therefore leading to not only protracted damage, but without any opportunity to recover from it. This is sort of similar to what can happen, in a manner of speaking, with IV fluids. If you have a longer-term elevated blood pressure, and we're talking about more than just a day or two here, the damage is not only going to be greater than, say, from exercise, where the process of sweating and simmer reduces the blood volume, but you get issues around it not being able to heal and it being far more extensive. It's because the nephron has a structure called Bowman's capsule. This capsule is intended to prevent large things like, say, blood cells from getting through. It's effectively a filter. That filter starts having holes punched into it by cells being squished through it, and other things again. It's kind of like a nozzle on a hose being blown off by pressure building up. It's similar in that way, and because of that, the damage is substantial, and the body is already weakened for most of these individuals, or they're already ill, or in other cases they're just plain injured, and of course causing more damage through, well, for example, increasing blood pressure. You now have issues around the whole, oh shit, your kidneys are failing because we gave you the wrong medication. So yes, there are problems caused by increasing the fluid level in the body without consideration of tonicity, and to a certain extent the need for any extra fluids anyway. A less obvious example would be something like diabetic ketoacidosis. The addition of more acidic material during diabetic ketoacidosis would lead to exacerbation of condition. Simply put, piling more shit onto a shit hill. This is why Hollywood and TV shows' depiction of IV fluids are not just very wrong, but in some cases outright misleading. No, you don't just start pumping a patient full of fluids without any further thought. In fact, fluids need to be very carefully considered before administration. If you don't do so, you can cause fluid imbalance, tissue damage, hemodynamic problems, drug interactions, drug failure, short and long-term problems, and more. It's not just, give me a bag of saline stat. It's, oh, blood pressure, drugs, what else do I need to consider before I start pumping them full of liquid? Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. Please do post any comments, questions, or suggestions you have below.